Now, there's another related clinician illusion, and that's on measuring therapeutic empathy. At the end of every session, my patients fill out a 5-item score scale, an empathy scale I've developed and validated. It's very sensitive to the slightest failure of empathy, and also a helpfulness scale, a 5-item helpfulness scale. And they both go from 0 to 20, and at 20 is a perfect score on both, and it's also the lowest passing score. And if the patient at the end of the session rates me even as a 19 on empathy, it means I missed something important. And on helpfulness, if it's a 19, they're saying it's pretty helpful, but you're not helping with something that's important. So those scales are just incredibly powerful, because I don't mind getting a failing empathy score. I kind of hope for that, because when I do, and then I can ask the patient, "Can you tell me what I was missing last week? You say that I understood, what you were saying, but I didn't grasp exactly how you were feeling inside, and I felt the same thing. Or I didn't feel the same thing. I missed it. Whatever is true, that's what I say. But I'd love to know now." And then they'll say, "Well, here's the part you missed," and then I paraphrase that, and they say, "Oh, now you've got an A. Now you've got an A plus." But again, many therapists, I would say most, refuse to use these kinds of assessment instruments because they think they know how the patient feels, and they don't. And it's true of your loved ones too. You probably think you know how your loved ones feel about you, and you may be way off. And sometimes as a therapist, you can overestimate how effective you are if you're not using these scales. And you can also go in the opposite direction and underestimate your effectiveness. And either way, you want to know how you're doing, because if you're doing well and you don't think you're doing well, that's not good, because you'll be all discouraged when you're actually doing something right. And if you think you're doing great and the patient isn't changing, like the one I talked about who's had violent, horrible childhood, then you're not doing your patients a service. I once treated a woman who I admired a lot. She was a bit of a colleague, not a personal colleague, but she was kind of a mental health professional, had graduate degrees, and she was also working in the area of ethics. And she told me that she had never had a happy moment in her life. And she'd been to a lot of therapy that failed, and she didn't have a lot of money, and she commuted from a long distance. So I saw her every other week for double sessions, so she wouldn't be having to pay for the train and for the therapy and so forth. But she hadn't been doing very well, and I was just starting to use my empathy scale, which was new at the time, and she'd been giving me kind of poor grades on empathy, and her negative feelings hadn't changed whatsoever. My heart really went out to her, and I asked her to tell me about how I was missing the boat with her, and that I discovered that I wasn't coming across in a warm or empathic way. And I asked her at the very start of a session, and she started to rip into me. And she was a very intelligent woman who I respected a lot. And so the things that she was saying, she was kind of seeing all of my flaws and just blasting at me. And it went on for 2 hours because it was a double session. And I just started feeling smaller and smaller and smaller. And by the end, I realized that she was so enraged with me that I would never see her again. So I didn't bother to make another appointment because I knew she wouldn't want another appointment. And she just stomped out of the room at the end and walked off to the 30th Street train station to take the trains to head home, which was probably about a 3-hour trip for her. And I felt just guilty and ashamed and frightened, and I didn't know what was going to happen because I had screwed up so badly in that session. And then several days later, I got a certified letter in the mail, and it looked kind of like some kind of legal action type of thing. And I was terrified because she was involved in high-level ethics evaluation of mental health professionals. And I thought, oh my God, she's probably opened an ethics charge against me. And I opened the letter, and it was this carefully typed letter sounding very formal. I thought, oh no, this is like the lowest point of my career. And I started reading it, and it says, Dear Dr. Burns, I just wanted you to know, on the way from your office to the train station, I got to thinking about our session and how angry I was with you and how you listened to all of my criticisms. And she says, no one's ever listened before. And I found that my depression disappeared for the first time in my life. And I've been feeling joy. And I forgot, I was so emotional at the end, I forgot to make an appointment. But would it be possible for me to come back next week so I don't have to wait 2 weeks to see you again? Because I can't wait to continue the fantastic work we were doing last week. And so what a fantastic thing that was. So that's another of the huge errors that, and most clinicians in the United States are not using my empathy scale. Some are using other empathy scales, which are not as sensitive to therapeutic failure. But it really allows you to see what's going on and to turn your therapeutic failures sometimes into tremendous successes.